Healthcare supply chain management is like the arteries that supply the healthcare system with the much needed resources. In Sudan, that role is played by the National Medical Supplies Fund, NMSF. The NMSF was founded in 1991 as the Central Medical Supplies Public Corporation before being renamed in the year 2015 when the NMSF Act 2015 was approved. The NMSF is tasked with ensuring that quality essential medicines are procured, stored and distributed to all states and health facilities across the country. Dr. Gamal Khalafala Muhammad Ali is the man who has led the transformation of NMSF in his role as the Director General. The first thing that Dr. Gamal realized when he took over is that health policy makers in the country did not consider health supply chain as an important factor in public health systems. Although NMS staff were highly trained professionals, they lacked understanding of health supply chain management, so training and continuous professional development became a priority for NMSF under his leadership. This was influenced by Japanese Kaizen concept in manufacturing and business. Kaizen simply means change for the better. The number of staff trained has increased to 580 from only 10 in the year 2010. The budget has equally grown for partly $40,000 to $670,000 by the year 2015. NMSF has engaged Pamela Steele Associates PSA in providing external perspectives on management. PSA has conducted several trainings to NMSF and Ministry of Health officials on areas such as leading strategy, leading change, health supply chain management, as well as human resource management. In order to continuously strengthen its workforce, the NMSF leadership embarked on a bold project of constructing a grand-purpose built supply chain training center on its premises in Khartoum. The Abdul Hamid Ibrahim Training Center was completed in 2017. The state-of-the-art training center was specifically built to cater for the development of the supply chain community in Sudan, as well as in other countries in the region, making it a unique facility in Africa. The center features facilities for formal training, group work and self-study, a conference hall with a seating capacity of 265, a health coordination meeting hall with a seating capacity of 90, 4 training rooms, computer lab with 25 computers, video conferencing facilities, electronic library with access to journals, physical library and study space. The center was officially opened on 17th April 2017 by His Excellency Omar al-Bashir, President of Sudan. The president was greatly impressed that he awarded the country's top honors, the Star of Achievement, to the Director General Dr. Gamal and the Medal of Achievement to the entire NMS staff. NMSF has become a model to be emulated by our peers in Africa, and delegations from different countries have visited the institution for benchmarking and knowledge exchange. NMSF has in the past hosted delegations from Eritrea, Somalia, Tanzania, Central African Republic, South Sudan, Chad, as well as Niger, Kaduna and Gombe states in Nigeria. The Nigerian delegation included the First Lady of Niger State, Dr. Amina Abubakar. In August 2018, a high-level delegation from the Ministry of Health and Population and the Central Medical Stores Trust Malawi visited the NMSF on a South-to-South knowledge exchange visit.
The 5 days that we have been here has been very inspirational, for we have learned what sort of stages the National Medical Supplies Fund of Sudan went through to integrate the prior supply chain systems into the national supply chain system. The prior supply chain systems included the malaria, TB, and the HIV/AIDS.
The integrated supply system put in place by NMSF was of great interest to the delegation.
Of particular interest has been the e-procurement and also inventory management. The e-procurement has been very interesting because National Medical Supplies Fund of Sudan has been able to float its tenders online, and also the suppliers have been able to submit their bids online and in real time. But beyond that, we've also learned a great deal in how the National Medical Supplies Fund conducts its evaluations of tenders. We did notice that there is a very big and high-level tender committee that evaluates the tenders, and the composition of the tendering committee is not only made up of National Medical Supplies Fund officials, but also officials that are external to the operations of the National Medical Supplies Fund, like Ministry of Finance, the Regulatory Authority, the Poisons and Medicines Control Board, and also the Auditor General. We thought this brings in confidence and integrity in the results of the evaluation, where all the stakeholders would trust the results of the evaluation. We also appreciated the criteria that they use in conducting the evaluation, like comparison with international prices, historical prices, as well as prices obtaining in the British National Formulary. Talking about the inventory management, we also learned that National Medical Supplies Fund is able to monitor the stock levels from the central level all the way up to the states. And also the states are able to make their orders to the central level online and real time. This enables the National Medical Supplies Fund to be able to monitor the stocks and avoid any stockouts.
But it's not just the Africa Health Supply Chain leaders who have noticed the good work of Dr. Gamal and the team at NMSF. The NMSF transformation caught the eye of the Director General of the World Health Organization WHO, Dr. Tedros Adhanom Ghebreyesus, who visited NMSF on the 14th October 2018.
First of all, I'm glad that this visit was arranged. I should be honest with you, I was a bit reluctant, to get anything new, or I'm being honest with you. Because when I was a minister, I was working in pharmaceutical finance and supply, and we have tried to build the same thing, and I know some other systems too. But I'm really happy by what I have seen today.
Dr. Tedros was impressed by the achievements of NMSF at a time Sudan was facing a lot of economic sanctions.
Sudan is, struggling with sanctions, but despite that, the contribution of the government for free medicine increasing at $150 million now is very impressive. It shows the commitment that Dr. Gamal actually had said. It's when there is true commitment that even when there is shortage of resources, you allocate the resources to help the needy, to help the poor who will not have any other option. Many countries actually struggle with availability of medicine. And in a few years you have increased from 43% to 95%. This is impressive. And it shows that there is commitment also in the organization itself, that you're doing your job to the best you can, and that you're using better systems. And also it shows that the reform you have started is also working. So I'm really glad to witness that.
The technological investment at NMSF also caught the eye of Dr. Tedros.
The use of technology. We were at the control room, and Dr. Gamal was showing us how the color changes when the temperature is not within range. And then if there is no response, or within a few minutes there is no response, then SMS to the person in charge to remind. I was even saying to Dr. Gamal, we have to use this system even in other programs, because there are many things that we do because of poor follow-up. We miss targets. It can help us if we introduce the same system to keep on track and to meet targets.
As we have seen earlier, NMSF has been championing knowledge exchange among her peers in Africa, and Dr. Tedros encouraged them to continue.
And I was even thinking about, sharing experiences would be really good with other countries in our continent. By doing that, you can pass your experience to others, and at the same time, there will be things to learn from others too. Even in a system that's really running well like yours, there will be some things that you can learn from others too. So I encourage you to reach out to your neighbors, to others, to communicate horizontally, to exchange experiences. But from WHO side, we would be happy, myself and my brother, Regional Director Ahmed, to work with you in order to support you in the excellent job you're doing, but and also sharing your experience with others.
Dr. Gamal has served in various capacities in healthcare supply management and regulations in Sudan. He was the first Secretary General of the Medicine Regulatory Authority of Sudan before joining NMSF as the Director General. After serving the Sudan Public Service for close to 3 decades, Dr. Gamal joined PSA as the Supply Chain Transformation Chief Strategist. With the wealth of knowledge that Dr. Gamal brings on board, the journey towards attaining PSA's mission of ensuring that no patient in low and middle-income countries suffers due to lack of essential medicines will only be catalyzed.